I'm Paul Foxman, and I'm a psychologist. I'm also the founder and the director of the Vermont Center for Anxiety Care, which is a private practice and therapist training center. Worry is our attempt to feel in control by anticipating what will happen so that we'll feel prepared and in control. I think we all intuitively realize that we're not in control and we can't predict the future. So I think worry is our effort to anticipate what is likely to happen so we can plan and prepare. So I grew up feeling like life was dangerous and bad things could happen. And that was really the basis of my worry pattern. I had a lot of worries. I had worry about my physical safety. My parents got divorced when I was 10 years old. I also had a medical emergency when I was 9. I had a medical trauma, really. I had the croup. There was a block to my airway when I woke up in the hospital the next morning after an emergency tracheotomy. When you worry, you are sending a message to yourself that you're in danger or something bad is likely to happen, and your body reacts. And so my body was in a pretty much a constant state of tension and arousal and vigilance. That's really why I became interested in worrying and what could be done about it and what could I do instead. Our brains are wired to keep us alive. And there's just something which we call the negative bias. We're always on the lookout for threats and dangers. And of course, we can misperceive what's a threat, say social anxiety, where the concern or the worry is about how other people are judging us or viewing us. And so we may have anxiety and worry about how we're coming across. And yet, in reality, in most cases, in those situations, we're not in danger, we're not being threatened, but we act as though we are, at least in terms of our anxiety reaction. So it has to do with the survival center. We suggest that the first step in getting control of worrying is to create a time frame in which we will allow ourselves to worry. And then at other times when worry thoughts arise, we tell ourselves to wait until our worry time to pay attention to it. We call this prescribing the symptom or creating a time for worry. So we're doing the thing that we're trying not to do for several reasons. One is to create a boundary around how much time and energy we put into it. And also because by overexposing ourselves to something that is negative, its power, or what we call cathexis, is reduced. Creating an alternative self-statement to counteract the worry. Worries are almost invariably negative, right? I think of worry as a story about the future, usually a negative story. So the positive affirmation intervention is to create an alternative story, but a positive story. And it has several criteria. And we create an affirmation or a parsimonious statement that we will say to ourselves each time we become aware that we're worrying. I'm thinking of an actual moment recently with a client. This was a child who developed a worry concern about getting sick. And she became preoccupied and started to reduce her food intake because she thought that if she didn't eat, she wouldn't have anything to throw up. This is really a form of worry that we call emetophobia, which is the fear of vomiting. I worked with her to create an affirmation, 4 components. It had to be a positive statement. It had to be a sentence or a statement that revolved around a word that was the opposite of the key word, in her case, sickness. So we came up with the idea of health and well-being. It had to have an action verb. It couldn't be a passive, and it had to be in the present tense. What we came up with was the following statement: I take care of myself and continue to feel healthy and strong no matter what. Worry is embedded in virtually all of the anxiety disorders. In panic disorder, which is the form of anxiety that involves sudden and intense arousal, often experienced as coming out of the blue, the worry is obviously about whether or not you're going to have a panic attack in a situation that resembles or reminds you of a situation in which you did have, in fact, a panic attack. Generalized anxiety disorder, which is another form of anxiety, is really all about worry. And somebody who frequently experiences apprehensive expectation. Obsessive compulsive disorder People who have unwanted or intrusive thoughts or images or urges often worry about whether they're going to act on them, and in many cases develop compulsive or behavioral rituals to counteract those unwanted thoughts or images. So in some cases, working with children and working with adults is not that different, except you have to be developmentally appropriate. Reason doesn't work with anxiety because anxiety is typically irrational. And children don't necessarily have developed the reality testing skills that most adults have around discriminating between what's real and what's not. It's really about developmentally appropriate communication, but the techniques are very much the same. I can teach kids the relaxation response just as well as I can with adults. You can even teach children how to meditate. Use the word so, S-O, in front of the worry. So if the worry is, what if the school bus is late? You put the word so in front of it and you have your client do that. And in distinguishing between worries that are harmless and those that are tragic, should they occur, you can use the so what approach with the harmless worries. It wouldn't make sense to use that technique with the tragic worries. But rather in that case, you would acknowledge how tragic it would be, but then you want to focus on the probability of such an event occurring. So you say, what do you think the chances of it happening are? High, low. So if you're spending a lot of time worrying about something that is highly unlikely to happen, you might recognize that there's a disconnect between the reality and what you're worrying about. My whole career started with just seeing clients and doing therapy. And then out of therapy came case examples that became books about anxiety, which morphed into speaking invitations, which created more clients. Then it created a center, for training therapists. And it all started with just finding my purpose, which was, to share what I learned about anxiety with other people and try to be helpful to other people, make a difference that way.
To take this course and learn about others, click on the link in the description and subscribe to this channel.